Okay, this video is about a book review for this book here called Stop Feeding Your Cancer. The author's name is John Kelly. John Kelly is an Irish primary care physician. Copyright of this book is in 2014. He works in Ireland, and in Ireland, he would be taking care of his patients, and a lot of them had cancer. And he had read T. Campbell's book, the famous book China Study, which is about the relationship between animal protein and cancer. And Dr. Kelly was impressed by the work of T. Campbell, whereby he could turn cancer on and off in rodents. Basically, if he gave them 5% or less casein, the animals would not get liver cancer. These were animals that had been exposed to aflatoxin. It's a carcinogen in moldy peanut butter. Or if they had a hepatitis B virus infection of the liver. That has a tendency to cause fibrosis, cirrhosis, and subsequently colon cancer. But these animals, if he kept their casein in a controlled diet below 5%, they would not get liver cancer. But if he fed them 20% casein, they got liver cancer. So casein is the milk protein. All right, so the idea of Dr. Kelly in Ireland was that he could just do the same thing with his regular people patients. So he had them, by the way, I noticed there's a lot of Irish nutrition experts. T. Campbell is from Ireland. Dr. McDougall is from Ireland. I'm from Ireland. Dr. Burkett is from Ireland. That's a lot of Irish nutrition persons. All right, so anyways, I always like to see the Irish have success at something because the British are always, beating on them. All right, so anyways, getting back to this book. So Kelly had his patients go on a vegan diet. I think he sometimes allowed them to eat a little fish. I got to double check that. But he put them on a low-fat, he put them on a vegan diet, and he had incredibly good results. Many of his patients went into clinical remission from colon cancer, rectum cancer, brain glioma, bladder cancer, prostate cancer. But he saw something interesting. Sometimes the patients, they would go into remission, and they would attribute their remission to some of their other therapy, whatever it might have been, surgery or chemo, and maybe it was, but the patients would attribute it to that. They would go off the diet, cancer would recur, dead. And here's a quote from Dr. Kelly. A clear pattern emerged of rigorous adherence to the diet showing extraordinary results, but then those who lapsed on the diet suffered recurrent cancer problems and they declined in health. In his description of the case studies, they tended to just crash and burn and die. And one of the things I would tell you is thinking about molecular biology, it's not like social thinking. Most people, their whole brain is programmed towards social thinking, and they just can't understand anything in biology, science, medicine, and nutrition. These are absolutes. You have a cell, okay? And let's say it has one receptor for insulin-like growth factor or something. Well, that cancer cell might have 100. So the point is, just a little bit extra insulin-like growth factor or some other chemical might cause that cancer to take off. You don't want to mess around. Don't give the cancer anything it wants. You can minimize your ferritin, your iron. You can minimize your leucine, your methionine. Why not do it? And you'll do that by going low-fat vegan and not eating any iron-fortified foods. So anyways, that was the pattern here, that the diet seemed to really help these patients. I realize this isn't a big formal research study with 1,000 patients under perfect conditions. You're never going to get that. That's never going to be funded. This guy just did it on his own because he thought it was a good idea. And it did seem to be a really good idea. Okay, now I also want to mention something from this book. This is Neil Barnard's book, and it's called Your Body in Balance. And what's interesting about it is he had a cancer patient with a similar story. This is a guy who wrote a book, the patient himself, Anthony Satellaro. We'll just call him Tony. And he wrote a book about Recalled by Life, how he went on a vegetarian macrobiotic diet and his widely metastatic, he had bone metastases, prostate cancer, went into remission. Okay, but this guy mentioned in Neil Barnard's case, same old story. The patient goes, well, maybe it's not the diet, goes off the diet, boom, cancer dead. And see, that's the problem is, sometimes when a cancer comes back, it comes back much more aggressive, and it might have had some internal mutations that make it more resistant to attempts to reverse it. So don't mess around with cancer. You get better, thank God, and keep on doing your diet and your exercise and stuff. The people I've seen who are alive 30 years later, people like Ruth Heidrich, people like that lady in a recent book review I did, Janet Murray Wakelin, man, they kept eating their vegan diet 100%, a lot of fruits and vegetables and exercising, especially fruits. So anyways, I thought that might be helpful. So Stop Feeding Your Cancer by Dr. Kelly. Really short book. It's only like 100 pages, 140 pages, and they're easy to read. It's a piece of cake. You read it on a weekend. So anyways, that's a small study of doing the low-fat vegan diet and him having quite good results.